and a very good morning to the respected judges and my fellow colleagues. I am Dr. NOOPUR SHINKRE and today I will be presenting a case report on Lipemia retinalis in a 27-day-old neonate. We have published this case report in the Indian Journal of Ophthalmology and it has been awarded the best paper at the Goa Ophthalmological Society Conference 21. So I do not have any financial disclosures. Lipemia retinalis is a rare manifestation of primary as well as secondary hyperlipidemia, more commonly familial hyperchylomicronemia. However, it may also be seen in familial combined hyperlipidemia, which presents as hypercholesterolemia or more commonly hypertriglyceridemia, and is the commonest form of genetic hyperlipidemia with an incidence of 1 to 2% in the general population. The characteristic fundus finding is retinal blood vessel discoloration, which ranges from salmon pink to creamish white, depending on the level of plasma triglycerides. It starts becoming evident when the triglyceride level exceeds 2,500 milligrams per deciliter. The grading of Lipemia retinalis as provided by Winger and Sachs ranges from early, in which only the peripheral retinal vessels assume the whitish discoloration, and it then progresses to moderate and marked, and ultimately the entire retina gets a salmon color and all the vessels show the milky discoloration. So a 27-day-old male newborn born at term to parents with third-degree consanguineous marriage was admitted with chief complaints of profuse light pink-colored umbilical and ear bleeds since a day. There was positive family history of hyperlipidemia in the mother and the immediate maternal sibling. The per-abdominal examination revealed grade 3 hepatomegaly and grade 2 splenomegaly. These were the fundus picture, which revealed pale optic discs with a salmon pink retinal background and tortuous dilated milky white retinal blood vessels bilaterally, suggestive of grade 3 Lipemia retinalis. A biochemical workup was done, which revealed a low hemoglobin level, markedly raised levels of serum total cholesterol, serum triglycerides, serum LDL, and serum ApoB, and low serum HDL levels. The other causes of secondary hyperlipidemia were ruled out, and the neonate was clinically diagnosed to have Lipemia retinalis secondary to familial combined hyperlipidemia. The neonate was started on lipid-lowering agents, antibiotics, IV fluids, and blood transfusions, and was weaned on skim milk. However, unfortunately, he succumbed to sepsis. We did an extensive review of literature. The Google Scholar and PubMed databases were reviewed to ascertain the number of cases of Lipemia retinalis, which have been reported in newborns and infants less than 16 weeks till the year 2018. So as per our literature review, only 20 cases have been reported so far, of which 7 have been reported in male infants. The youngest reported male newborn with Lipemia retinalis is a 28-day-old suffering from familial hyperlipidemia secondary to lipoprotein lipase deficiency. And among the female newborns, the youngest has been reported in a 3-day-old secondary to familial chylomicronemia with a gene mutation. To the best of our knowledge, no other case of familial combined hyperlipidemia showing grade 3 Lipemia retinalis with such markedly elevated serum total cholesterol and triglyceride levels has been reported in a male neonate as young as 27 days, which makes this case report unique and presentable. Furthermore, the literature review also highlights a few cases of Lipemia retinalis, which have been accidentally detected while screening premature newborns for retinopathy of prematurity, which warrants appropriate referral of suspicious cases and their detailed ophthalmological evaluation in order to detect the presence of Lipemia retinalis. I would like to conclude by highlighting that persistent and uncontrolled hypercholesterolemia and hypertriglyceridemia, especially in newborns and infants, can lead to other morbidities such as premature atherosclerosis, coronary artery disease, pancreatitis, and hepatic failure, which may be fatal. Hence, early detection and demonstration of Lipemia retinalis in such cases becomes important. Thank you.
Very interesting presentation. What were the systemic pediatricians? What did they diagnose it as? Was it some liver issues or hepatic issues in this child?
So actually, the child, when the per abdominal examination was done, the child was found to have hepatosplenomegaly. Also, the blood which they collected was kind of milky and frothy. So they sent a ophthalmology review for this patient, a fundus examination. So we diagnosed the patient to have Lipemia retinalis. And it was kind of matching with the biochemical workup of the patient. The triglyceride levels had crossed 10,000. So it was consistent with the findings.
But they did not make any diagnosis, the pediatricians or physicians, because that's more important, because there was some gross abnormality, I think, with the hepatic function or something systemic, I think.
Yes, sir. It was diagnosed as familial combined hyperlipidemia because there was no other secondary cause for the hyperlipidemia.
But there is no family history as such.
There is a positive family history of hyperlipidemia in the mother and the maternal siblings. The sibling of the mother, actually, her sister also had hyperlipidemia.
But they did not die; they are alive. It was not very severe in them, probably.
No, sir, it was not severe, and they did not know it. Once it was diagnosed in the child, then the blood sample of the parents was collected, and then it was retrospectively diagnosed.
Maybe it was some kind of Mendelian genetics, some kind of inheritance pattern. Maybe it can be worked out. I don't know. That's
Yes, sir, it could be.
Couldn't get a fundus picture of the child. Could you get a fundus picture of the baby?
Yes, yes, ma'am. Actually, we took it on the fundus camera only. We positioned the baby that way, and we managed to take the fundus photo.